Welcome back on this Health and Wellness Thursday. We are going to focus on something you may have not thought about in a while, but many people take aspirin as a daily regimen. That might be something you need to reconsider. Let's find out more.
We all know that taking aspirin daily is a good thing, or is it? Revised guidelines recently issued by a government task force indicated that aspirin should not be taken as a part of a daily preventative routine. Concerned and confused patients have flooded doctors for clarification over the issue, which is now clear as mud, considering heart disease and stroke are leading killers in the United States, especially over the holidays. It begs the question, who should and shouldn't take aspirin to help prevent cardiovascular disease and stroke? Joining us today to help clear up the confusion is Dr. Michael Gibson, an interventional cardiologist. Dr. Gibson, thanks for being here today.
Well, thanks for having me join you.
Based on these new guidelines, should everyone stop taking aspirin?
Oh boy, don't listen to the headlines. Listen to your doctor. Check in with your doctor before you stop taking aspirin or start taking aspirin. I think there was a lot of miscommunication. These guidelines and headlines are for those people who've never had a heart attack or stroke, and for those people over 60. Very different if you talk about someone who's had a prior heart attack or stroke. And in that case, the benefits probably clearly outweigh the risk, but you need to check with your doctor. And before starting, check with your doctor. There are going to be some of you who may have a benefit and limited risk from taking aspirin.
How does aspirin work to help prevent cardiovascular disease?
Every day, all of us cut ourselves, nick ourselves, the bleeding stops. It stops because you have these little things in your bloodstream called platelets, and they clump together to prevent the bleeding from those little blood vessels. Now, that's great if it's your finger. It's not great if you prevent or cause a clot in your heart or your brain. A clot there can cause the blood flow to stop, choking those organs off from the oxygen that they need. Aspirin works by preventing that clumping and preventing the clotting in the brain and the heart. It allows the blood to continue to flow there and providing the life-saving oxygen that you need.
What are the common problems with taking aspirin, and are there any other options?
Well, a lot of you know from personal experience or from your relatives, there can be some stomach problems. There are some new options out there. One of them is called Vazalore. It is different than some of the current compounds. It's not a pill, it is a capsule, and it's filled with liquid, and that liquid has aspirin in it. Now, here's the key. It goes and floats down beyond the stomach where the problems occur, gets beyond the stomach, and then delivers the aspirin further down in your intestine. And that makes it a little easier on the stomach. Now, when you compare this new drug to aspirin, regular aspirin, 7 days later, you see fewer erosions and fewer ulcers of the stomach lining.
What about people who are over 60 years old? Should they take a daily low-dose aspirin to prevent heart disease?
Great question, and it's a question you should ask your doctor. The two of you should work together to decide if the benefits outweigh the risk in your particular case. If you're someone who's had blockages on CT scans or diabetes or other risk factors that put you at a high risk of a stroke or heart attack, then the benefits in your case may outweigh the risk. But this is a conversation you should have with your doctor. Listen to your doctor, not to the headlines.
And what is the difference between enteric-coated aspirin and immediate-release aspirin?
Well, for 4,000 years, we've had aspirin, and that aspirin in that form gets absorbed right away, immediately. A few decades ago, scientists said, why don't we create a coating around the aspirin so it's easier on the stomach? And that's called enteric coating. Now, it might be easier on the stomach, but the absorption is more slow and the absorption is more erratic for the enteric-coated aspirin. And when you talk about that compound we just mentioned, Vazalore, compared to that enteric-coated aspirin, it gets absorbed more rapidly and it gets absorbed more consistently than the enteric-coated aspirin. Big issues, particularly in the acute setting when you want something on board quickly, and chronically where you want something that's giving you very consistent absorption.
If people people are watching this interview and they're currently taking aspirin regularly, what do you advise them to do?
Talk to your doctor. Don't stop your aspirin until you talk to your doctor unless you have bleeding. Again, if you're on aspirin for a heart attack or a stroke, the benefits most likely will outweigh the risk, but it's a conversation you need to have with your doctor, and likewise starting it. It's a conversation you need to have with your doctor to see if the benefits outweigh the risk.
And where's the best place to go for more information?
Incredible websites. Go to a place like the American Heart Association. They have very credible, consumer-friendly information. If you're interested in that new medicine, Vazalore, Vazalore, go to vazalore.com.
Well, thank you so much, Dr. Michael Gibson, for joining us today. Really appreciate this information about aspirin, and thank you for clearing this up. Appreciate your time.
Thanks for having me on the show.